Frequencies are delivered to parts of the body to help relieve pain and inflammation. The electrical impulses of the frequencies stimulate the body and produce a natural pain reliever.
Frequencies are electrical pulses. We hear them as sound, so musical notes have certain frequencies. We also use frequencies to open our car door. So you use a key to open your car door lock, but you can also use the key fob that sends out a frequency that opens your car only. It's a very specific frequency. We use frequencies all the time. Using alternative medicine, you expect them to get better in 6 to 12 months. When you add the frequencies to it, because the current by itself increases energy production in the cells by 500% in 2 different animal trials, the current helps give the tissue the energy it needs to change, and then the frequencies appear to tell the tissue what to do. So it takes the patient to a new place where everything else you're doing can work more quickly, more easily.
Many patients with conditions that did not respond to other medical therapies have found positive effects from using frequencies. This non-invasive treatment can help patients with fibromyalgia, nerve pain, PTSD, scarring, along with many other medical conditions.
We feel that the frequencies are safe. We've been using it at our center for approximately 5 years. The device itself is classified as a 510K device, which places it in the same category as a TENS unit. However, the current used is approximately 1/1000th of the amount of current that would be used in a traditional TENS unit, which makes it much better tolerated in pediatric populations. Being able to target specific frequencies to give symptomatic relief within minutes is life-altering for many patients.
In 1995, Carolyn McMakin discovered the remarkable effects a 2-channel microcurrent machine had on healing muscles and nerve pain. She's helped many patients with conditions who did not respond to other medical therapies heal with the use of frequencies. This is a new treatment paradigm using frequencies to treat specific conditions.
When I got to Chiropractic College, towards the end of my 4th year, I met a chiropractor named George Douglas. He had worked with an osteopath who bought a practice in 1946 that came with a machine that was built in 1922. And in 1983, he got this list of frequencies. And we started using them in my practice with a microcurrent machine. And within a year, I was treating muscle pain and nerve pain that's just impossible. My whole practice became the 5% of patients that nobody else can fix.
The stories that I can tell about Frequency Specific Microcurrent, I've been using it as a modality in my practice for 20 years, and some of the things are nothing short of miraculous. I have seen an artist who had adhesions on his thumb that couldn't bring his thumb all the way down. I wasn't even finished running his frequencies, and he's brought his thumb all the way down as far as it would go for the first time in 20 years. Someone can come in with almost anything, and I have frequencies that I can use to address the condition and the area of the brain. If people have problems that need ongoing treatment, we can get them a custom care unit that would allow us to treat at home on a regular basis.
The treatment itself has been very effective in the patients that I treat. I work in a freestanding rehab center which deals with inpatient and outpatient chronically injured patient populations, primarily pediatrics. In the inpatient setting, we've seen dramatic effects in regards to recovery in acute injuries, including traumatic brain injuries, spinal cord injuries, major burns, post-operative settings, and in chronic pain itself. In the outpatient setting, I work with patients with cerebral palsy, multiple different types of chronic pain, chronic musculoskeletal injuries, which have been resistant to traditional medical therapy such as injections, physical therapy, medications. What has been the most fulfilling about this is the improvement in quality of life, and that is why I decided to pursue it at our center.
The most important thing to me is not so much what I can do with it, with the frequencies. The important thing to me is the fact that the frequencies are teachable, that the effects are reproducible, and that I can teach other practitioners to help patients relieve nerve pain, muscle pain, low back pain, Crohn's, asthma, brain injuries, all of the things we can treat with the frequencies. And then people wanted a book that was easy to read for consumers and practitioners. And that book I finally wrote in 2017, it was released. And it tells the story of where the frequencies came from and how we developed the protocols by accident, working from the list, to find all of these protocols that are able to help people. That's what I'm there for. That's what's important to me, is what Frequency Specific Microcurrent does for patients and practitioners to change our world.
To learn more about frequency-specific seminars, visit frequencyspecific.com.